Hi, I'm Phil. I'm a psychotherapeutic counsellor and a trauma therapist. Today I'm going to speak a little bit about phobias and racket feelings. Racket feelings being the term for when our subconscious swaps one feeling for another, which it does so we can remain in denial of certain feelings that are just too hard for us to manage, and how phobias can assist us to keep those racket feelings in place. So, to help you better understand this concept, I'll give you an example of what might be the experience for some people who racket or swap a fear of physical harm or being abandoned with shame, which is also a fear to fear swap in a way, as they typically replace their fear of harm with a fear of judgment. I'll do a separate video that focuses on other racket emotions, such as when people racket their anger by feeling guilt or fear instead, and others who might racket shame by feeling or anger instead, because it's quite a big subject and there's a lot to talk about. So we first need to be mindful that when we racket emotions, that it's a subconsciously driven process that we've typically developed in childhood in response to negative experiences in our environment. So really, it's a psychological defense that enables us to feel one thing over another because it makes life more manageable or even increases our likelihood of survival, also our developing brain beliefs. So in a way, when we're beginning to racket emotions as children, what we're really doing is adapting to survive a particular situation in the most optimal way that our brains can do at an age where a lot of adult options to survive are just not going to be available. So if our subconscious rackets or hides a fear of physical harm or a fear of abandonment by converting it into shame, then we're going to need to believe that we're deserving of that shame, because shame won't just move in to directly replace the fear. It can't work like that, because we're designed to feel appropriate feelings at appropriate times. And that's a survival mechanism. So for us to do this, something has to happen or be happening that enables us to distort the reality of the situation and create some sort of rationale that enables us to direct a lot of focus on the belief that the shame is the feeling that we most deserve to feel, that it's the feeling that we should be prioritizing over a fear of harm. And to do this, we utilize the reality of the situation that's scaring us, and we build a rationale around that to form a new belief system. So a child who's believing that the neglect that they're experiencing might physically hurt or kill them might rationalize this situation by convincing themselves that this is happening because they have no value to the people looking after them, or that they're bad, that they're ugly, or in some way not good enough to deserve positive attention. Anything really that forms a negative self-belief that they can then hyper-focus on and distract their minds away from the very real fear of harm or death. And this newly developed self-belief is going to be easy for them to validate, because if they did have worth, then people wouldn't be neglecting them like they do. So the evidence is going to be there for them to believe day on day. So as a way of understanding what's going on in their world, they begin to believe this internal perception of themselves, and they become hyper-focused on this being the reason for their neglect. So in effect, they start to blame themselves for their own mistreatment and believe that it's deserved. And because the way that they're now seeing themselves is repeatedly validated by the poor way that they're being treated, then the I am not good enough or I am bad self-belief or life script becomes figural, which means that they start to fixate on it and begin to feel more scared about being seen as bad or ugly or worthless or not perfect than they do about being physically hurt. So being shamed becomes the bigger fear. And because we're swapping extreme feelings of a fear of harm to self for a fear of judgment, then the fear of judgment needs to be experienced at an extreme level too. And this is where phobias come in to help this along. But not just any phobia will do. It needs to be a phobia of something that creates shame or judgment. So a fear of being seen as bad or a failure or ugly, for example, are going to be prioritized over the development of a phobia of things that might cause you physical harm, such as being attacked or germs or your house being broken into. Because these last few examples of phobias, they're there to generate fear of harm to self so we can avoid certain things that might hurt us, or to create fear so we can continue to feel fear rather than another emotion such as anger. As a lot of people who suppress their anger racket their anger by feeling fear or guilt instead. So their phobias will be different because they will need to generate fear and guilt to mask their anger. And some people with CPTSD might also generate the same types of fear of harm phobias. so they can project their historical fear onto something in the present and be scared of that instead. So for these people, the generation of shame isn't going to be their priority. So a typical phobia in relation to shame generation would be based on the generalized belief that people are going to see or think about us as we see and think about ourselves. So if we think we're bad, we're going to be projecting the belief that other people think that we're bad too. And because of this generalization, this phobia is going to have us continuously on the lookout for evidence of this. And if we look hard enough, we're bound to find something that we can interpret as a judgment. And if it isn't there, then we can fantasize that it is. Or we can find another element of ourselves to become phobic about. And a good way to do this would be to develop a negative fixation on a particular part of our person and create some sort of body dysmorphia or phobia around the physical aspects of our body. Because if you're doing this, then you're likely to start projecting that people are noticing and judging that aspect of you that you're hyperfixated on, which is going to make you project even more that you're being judged. There's just no limit to how many things we can become phobic of if we want to direct our fears in a specific direction. So it's sometimes hard for people who swap their fear for shame to get their heads around this concept because they do tend to still experience a lot of fear, which is not in question. Of course they do. It's just that their priorities have altered, and what they now feel the most fear about is being shamed or as being seen as shameful. And one example of where people might prioritize the management of their shame over self-care would be in the area of self-improvement, as some people might put their lives at risk by undertaking illegal or unnecessary cosmetic treatments and surgeries, or following unhealthy dietary patterns or extreme forms of exercise, just so they can perceive themselves in a better light and have some control over appeasing their terrible fear of judgment from others. People who have a healthy access to preservation and they're not, they're not driven by shame. They can sense a healthy level of fear for self. They'd be unlikely to take such risks because they won't be needing to prioritize the appeasement of shame, and their fear would warn them not to take unnecessary risks for vanity. So in effect, people who racket fear for shame typically need to keep creating shame for themselves to mask the fear of annihilation that's buried beneath. And the examples I've just shared are just a few of the ways that we can do this. And projected beliefs are another one, and probably one of the most useful for giving yourself a quick fix of shame. And this is when we think we know what people are thinking about us. So in effect, we're believing that people are seeing us as we see ourselves, and that they're judging us like we judge ourselves. So if we walk into a room and we think, our hair is ugly, we're going to project that people are thinking that too. Another way to generate a load of shame would be by ruminating on things that prove to you that you're bad or that you're not good enough, or ruminating on things that you've done that weren't exactly moral, or even by continuing to do things that aren't moral. So if we're working to understand how we might be racketing emotions, then we need to be very mindful that these racket emotions and the phobias that enable the production of large quantities of shame, they're serving a very important purpose, and they have been for the longest part of your life. And that even though the shame that we may be generating for ourselves is horrendous, it's what we know how to deal with, and it's feeling that intense so it can mask a feeling of equal or greater intensity that we don't know how to deal with. And this is why it's often the case when these survival strategies fail, when the racket doesn't work anymore, that people come to therapy. Because if our capacity to racket emotions reduces, which it can do, if the psychic energy that we subconsciously use to manage our denial fails due to burnout or illness, or if we encounter further traumatizing situations that put us in a state of collapse, then we're suddenly going to find ourselves experiencing extreme feelings of historical repressed fear in the present that we're going to have absolutely no idea to how to deal with or even where they're coming from. And this is because we might have split off the memory link to those historical feelings, so we can dissociate from the visual memory of what caused them. Because after all, our brain has been focusing on shame, and to do that, it's had to distort or dissociate from a lot of information that relates to the feelings buried behind that shame. And this feeling of historical feelings without a memory recall is often what's occurring for people suffering from CPTSD. They're often still reacting to things in the present that really happened to them in the past. It's just that their hypervigilance is going to be overriding the logical part of their brain's capacity to reassure them of that fact, because the brain just doesn't want to go into that section of memories. It would rather find a phobia as something to be scared of in the present and project all its worries onto that. So if we're going to work towards challenging a shame racket by reducing the ways that we create shame for ourselves, then we need to have a plan in place to deal with the feelings of fear that are going to emerge in place of the shame. Because this is going to happen, and your brain is going to fight you on this and find all sorts of ways to convince you not to do the work. It's going to want you to focus on the phobias or its projections, and because it's going to want you to be generating shame, because you don't yet have the tools to deal with the fear behind it. You're just not equipped to do that. You're more equipped to deal with shame. It's why progress is long and difficult for people with shame-based processes, because however terrible their shame makes them feel, that's easier for them to deal with than the fear that's lurking behind it. So if we're going to challenge a racket feeling, then we need to be aware of all this stuff first, so we can prepare for what's to come, because it's not going to be easy and it's going to be frightening. But if we at least have some awareness of the process, that might help us to stay more rational as we go through it. Because after all, the fears that are buried within us aren't about what's going on in our life now. So if we can meet them as adults, then we have more options available to deal with them. Because as adults, we can get some support to help us through all this stuff. It's hard to do that as children if the people in your environment were the ones who were scaring you in the first place. Back then, racketing the emotions so you felt something else was the best option. Well, hopefully that was useful for you. And if you have any questions, pop them in the comments, and I'll see if I can do you a video in response to an answer, or give you a quick response in the comments. And take care, and I'll pop another video up shortly. Goodbye.